After any type of trauma, it's possible for a joint to experience a separation and what can be termed as a dislocation. Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today, we're going to talk about dislocations, the common areas for them, and how you should best treat them. Stay tuned, it's coming on right now. There are several ways to categorize what happens to a joint after a trauma. Sometimes they can be subluxated. And subluxated means that the joint is slightly out of alignment. It'd be like my hands, just slightly moving. But also, if it's more than a subluxation, it can be a dislocation, where the joint, instead of sitting on its normal plane, comes off and actually falls out of where the joint's supposed to be. You may have seen this before in an athlete or one of these extreme sports where, for example, a shoulder, instead of being up in the shoulder socket, ends up releasing and coming out from under that umbrella and then coming up into this area. Now, dislocations can be incredibly painful because, as you can imagine, all the soft tissues around that joint get completely disrupted while the bone moves from one position to another. That same stretching that goes on to the muscles also happens to the ligaments, to the nerves, to the arteries, any blood vessels. It's all getting affected. So whenever there's a dislocation, the best thing that can happen is that the dislocation is set or relocated as quickly as possible. Because the problem is, the longer the issue is out, the issue is in place where, again, if a shoulder comes out of the joint socket, if you will, it's going to be putting pressure of this nerve and this artery and these blood vessels. They're going to be coming over, getting crimped off. And so if it's there too long, we can have a disruption in the function when the joint does come back to its normal alignment. Not only that, but ligaments are not like muscles. Muscles, when you stretch a muscle, unless you tear it, it's going to bounce back pretty easy like a rubber band. But a ligament, think of it more like a plastic bag. If you take that plastic bag and you stretch it, it doesn't come back very well at all. And so if you have a ligament around any joint, could be finger, could be elbow, could be shoulder, could be knee, if that thing dislocates and you leave it out there, the longer it's out there, the more that ligament is under that tension, the more loose or lax it's going to be, and it's going to make you susceptible for chronic dislocations. So what do you do for dislocation? Again, number one, get that thing reset as quickly as you can. Ideally, you want it done by a professional, someone who knows what they're doing, because you don't want to create more damage moving the joint back into a normal alignment and pinching things in there. There are very certain ways to do certain joints, especially when you're talking about hips, knees, elbows, shoulders, those kinds of things. They can be tricky. So get to a trained professional immediately. Also, afterwards, you're going to want to ice that joint because it's so traumatic. You're going to want to keep ice on it to keep swelling down and help with pain control. There will very likely be some pain medication that you'll be wanting depending on the size of the joint. Oftentimes fingers, no big deal, right? If your finger dislocates, it moves back in. Even if you just pull it a little bit, it's going to move back in, and then it's just going to be sore for several weeks, but it's manageable. The other thing you can do with joints that have been dislocated is stabilize them. Either, depending on the joint location, like on a hip, you might need a brace to kind of fixate that into place. But in some cases, even just putting some well-applied kinesiology tape on will help enough stability, or some white, what's called zonus porous tape, what you think of as athletic tape. You can put that over the joint as well, and that will keep it stable and from moving, from being irritated, and from possibly re-dislocating. So that's a little bit about joint dislocation. If you've ever had one, you know it can seem weird at first and not even that painful. And then once it gets reset, now that gives you a bunch of relief, but then the pain starts setting in from the damage that was done. If you know anyone who has this dislocation problem or a chronic dislocation, please send them this video. I would greatly appreciate it. And if you have any other questions about this topic or anything that you'd like to see us talk about in Health Matters, please let me know. My email is jim@ramoslaw.com. So until next time, remember, your health matters.